Hello, good morning. Welcome, everyone. Thank you very much indeed for being here with us, ladies and gentlemen. I'm Shuli Ghosh, and over the next 90 minutes, I'll be leading us through this discussion on how to harness innovation to empower the health workforce for non-communicable diseases. So right now, there is an alarming shortage of healthcare workers globally. The pandemic, the cost of living crisis, recruitment and training issues, overwork, burnout, all of those things have taken their toll. The WHO estimates a shortfall of some 18 million health workers globally by 2030, and this at a time when we have growing challenges of NCDs and an aging population. Now more than ever, we need more healthcare workers, tens of millions more. The shortages are pushing health systems to breaking point, delivering universal healthcare, meeting the Sustainable Development Goals, combating NCDs, dealing with the next pandemic. All of these depend on a well-equipped, well-trained army of healthcare professionals. But against this background of staff shortages and increasing demand, we're also seeing fundamental changes to healthcare systems. We have digital tools now, remote interventions. These are on the increase. And this technology actually provides an opportunity to alleviate the burden on healthcare workers by automating and supplementing systems, upskilling community health workers, and task shifting. The crisis we're facing over the shortage of healthcare professionals is somewhat of a theme at this year's World Health Summit. This is the first of 3 sessions looking at the issue. There are 2 others to follow, one focused on the future of nursing and one looking at how work or employment can improve population health. This session is specifically going to be focusing on practical solutions to unlock the full potential of innovation and digital tools to alleviate shortages and strengthen the workforce of the future. And to that end, we have a fantastic panel of speakers who are going to be sharing with us their insights and their expertise, and they will also be taking questions from the audience. So I hope there are plenty of those. But first, we're going to start with an overview. I'm delighted to introduce our first speaker, Katie Dane, Chief Executive Officer of NCD Alliance, which are co-hosting this session along with Roche. Katie, great to see you with us. So, as I was saying, the delivery of universal healthcare depends on having a good enough, strong enough, big enough health workforce. We're just a few weeks on now from the UN high-level meeting on UHC. What was the general consensus?
Good morning, everyone. Great to be here and great to see everyone. So, I mean, many of us were in New York for the 3 UN high-level meetings that took place around health, UHC being one of them, TB, Pandemic Prevention, Preparedness and Response, PPPR being the 3rd. I think that a general consensus on one level was, health is high on political leaders' agendas. The fact that we had an unprecedented, 3 mega high-level meetings in 1 week is really testament to that in a way. But, I think the backdrop of the meetings were really important, and I think 2 statistics really kind of, stuck with me throughout the week, which was new data from WHO and the World Bank, specifically on universal health coverage in terms of the progress made. And, essentially the data said more than half of the global population, that's 4.5 billion people, are not fully covered in terms of reaching access to essential and basic health services. That's one. And number 2 billion people are facing severe financial hardship in actually accessing that health service. So, the overall message in the UN General Assembly was progress is way off track. It was also the midpoint, the kind of half time of the Sustainable Development Goals, which are all coming up to expire in 2030. And you can look across all those goals and we can see that we're off track. One of the reasons is obviously the COVID-19 pandemic putting us back many, many years. But I think a positive out of the meeting, we could talk about how strong the outcome documents were, whether they really took the agendas forward. I think question marks around that. But in terms of this agenda, in terms of the health workforce and NCDs, number 1, health workforce was really recognised throughout all of the 3 declarations. Essentially, it's the lifeblood of a health system. Unless you've got the staff to deliver the essential services at all levels of the healthcare system, primary healthcare all the way up to tertiary, we can be talking about access to medicines, we can be talking about digital technologies, but you need the health workforce in order to be delivering it. So that was a really strong message throughout all of the week. And I think some of the challenges that were picked up through the UN General Assembly and the declarations were things that you already kind of started highlighting. It's the sheer number of shortage of health workers, 18 million by 2030. And this is a global challenge. It's obviously particularly acute in poorest nations, but it really is all income countries facing challenges around the number of health workers that are needed. But it also comes into challenges like recruitment and retention, making sure that we're retaining good health workers, that we're actually paying them well, a major challenge. We're incentivizing them to stay within that profession throughout. And also another important angle that came out of the UN General Assembly was the gender dimension. Essentially 70% of the health workforce are women. And so this is a gender equality agenda as much as it is a health agenda.
Yeah, and clearly, as you've said, we are pretty off track right now in achieving UHC, but also the goals towards reducing NCD mortalities. In terms of the workforce crisis, what impact is that having? What challenges are you seeing?
I think one of the main challenges of the health workforce is shortages, retention, retainment, et cetera, but it's also making sure that we have a health workforce that's really equipped to deal with the global health challenges of today as well as tomorrow. NCDs are undoubtedly that. All countries, low middle income countries particularly, are seeing the biggest burden being cardiovascular disease, cancer, diabetes, chronic respiratory, mental health, you name it. And when you ask the question, are our health workforce globally equipped, ready, oriented towards dealing with chronic conditions, the very clear answer is no. And when you start asking, why is that? Why aren't they equipped to deal with this NCD burden? I think you almost have to go up in the helicopter and actually look at it from a kind of global policy and financing perspective, because we all know that in NCDs we've been playing catch up in a way, connected to some of the other big global health priorities like HIV/AIDS, TB, malaria, women and children's health. NCDs over the last decade have really gained a lot of traction, but it's almost like we're still playing catch up, and as a result, the amount of money going into NCDs is still really, really pitiful, both at the global level, even if you look within WHO, how much money is going into NCDs versus these other issues. It's still a challenge, and we've still got that terrible number of less than 2% of development assistance for health going to non-communicable diseases. And the reason I bring that up is because it essentially has a knock-on effect across all of the NCD response, including the health workforce. And I think what we see in many countries is that the health workforce is in a way a mirror of the broader health system. And essentially, health systems in many low and middle income countries are still oriented to acute care. They're not really oriented towards a chronic care model, which is prioritizing health promotion and prevention, number one, early diagnosis, which is so important in NCDs and is really doable and possible for so many of the conditions that we're talking about, as well as having that chronic care management across the whole life. So in a way, it is a kind of result of the catch-up that we've been playing at the global level.
I know we'll probably have quite a lot of conversation during the session about prioritising NCDs over other areas of the healthcare system. One thing that the bodies like the WHO have said is that health workers could be supported better with digital tools, innovation, other technology. What are your thoughts on that? And do you think there's enough awareness of how much difference they could really make?
I think, digital health is a major opportunity for NCDs, as it is for many other global health issues. I mean, we're seeing integration of digital solutions across, diagnostic technologies. We're seeing it across self-management in terms of, diabetes and hypertension, people managing their condition through regular consultations with their health workers via SMS and phone calls, rather than having to travel to their health system, their health service, paying money in order to receive the treatment. It really does have a difference in terms of access as well as affordability. But as well, digital solutions are helping in terms of, electronic records of patients, digital registries within countries. So it's the kind of surveillance and monitoring and the importance of data that's generating, so that health services can quickly respond, reorient as they need to. as well as digital being a really important way that we're now training doctors and different health workers. There's so many different curriculum available online. So digital cuts across the whole board. But I do think within the digital health space, generally, and this particularly relates to NCDs, it's the age-old thing of making sure that we're leaving no one behind and that we're really focusing on the equity side of things. Because at the end of the day, older people, people with lower educational attainment, certain minority groups are not necessarily going to have access to the digital solutions that we're talking about. So it's ensuring that we're really having a kind of digital inclusion strategy at the centre of what we're doing around digital.
So if you're anything like my mother, who does not own a smartphone, none of this would make any sense to her whatsoever. We saw that there was quite a lot of momentum during the pandemic in the uptake of digital health. Has that slowed down, or is that still continuing?
I think in a way COVID-19 was there were obviously overall hugely negatives around the COVID-19 pandemic, but there were silver linings of it. And I think it did actually kind of create this catalyst of forcing us into a different way of providing health to communities. And I think that is one of the silver linings of COVID, which has continued. It's actually taking, health services into people's home to make it as easy as possible for them through primarily digital solutions, as well as things like task shifting to community health workers so that we're not always relying on specialists or doctors. Non-clinical physicians, community health workers are so important in screening, treating, managing things like hypertension, diabetes, asthma, you name it. So I think that has continued in many countries. It's just making sure that the digital approaches are sustainable and that they're scalable and that we're actually learning from different countries in what's working and what's not.
So when it comes to non-communicable diseases, what kind of innovations are we talking about? What are we seeing in terms of health solutions, wearable tech, artificial intelligence? What are the things we should be excited about?
Well, I think, if you look at diabetes as one example, diabetes has been described by some as a data management disease. It's essentially, the core components of diabetes care are essentially using, real-time data, real-time metabolic and behavioural data to inform decisions, to be informing the management decisions that people are making. And so, things like real-time continuous glucose monitoring, as well as automated insulin delivery for people. This basically just puts so much more in the hands of the patients. It puts patients at the centre of their care. And it also helps inform health workers, the health workforce, to ensure that they're providing those people with the constant management and needs that they're needing. So it's things like that. It's also, I think the other kind of important part of digital health and NCDs that perhaps is, sometimes forgotten, is just the importance of, and this is obviously kind of a constant priority of the NCD Alliance, but it's always making sure that when we're designing and shaping digital solutions, that we're co-creating them with the patient. Because otherwise you'll end up with this fantastic, jazzy, app or whatever it is. Doesn't necessarily actually really meet the needs of patients or communities or the particular behaviours that you're trying to change. So really trying to make sure that there's a real focus on
exactly. What kind of
co-creation, patient-centred approach is always the way to go.
Brilliant. Katie, for the moment, thank you very much indeed. Stay with us because we're going to bring the rest of the panel onto the stage now and to join the conversation. I'm delighted to welcome a great panel of speakers. Bente Mikkelsen is the director of the NCD department at the WHO, where her focus is on achieving the SDGs through the reduction of premature deaths from NCDs. Welcome, Bente. Dr. Usahan Enabalule, who is the past president of the World Medical Association. He's a chief consultant family doctor in Nigeria and works to strengthen healthcare systems and promote the well-being of physicians globally. And Paula Head, Policy, Value and Access Lead at Roche UK. As a past CEO at several NHS hospitals and NGOs, Paula has wide hands-on experience of delivering solutions to workforce issues. We were also hoping, you'll have noticed from the information around this session that we were expecting to have His Excellency Dr. Khaled Abdel Ghaffar, the Minister of Health and Population for Egypt. He sends his deepest regrets. Unfortunately, of course, because of recent events in the Middle East, he is unable to join us. But we have a fantastic panel of speakers, so we're going to kick off now and look at the challenges, the impacts, and the possible solutions to the healthcare workforce shortage. And Bente, I'm going to start with you because the WHO has actually called on UN member states to categorize the shortage of healthcare workers as an urgent strategic priority. Tell us how bad it is. What kind of statistics are we looking at globally?
Yeah, thank you very much. And I think Katie has already gone through some of the statistics. I mean, I guess that this audience already really understand first and foremost the magnitude of NCDs. And I need to say that again. So 7 out of 10 deaths is from NCDs. And when we looked into the excess mortality during COVID, we have very strong reasons to believe that a major part of that was also because of NCDs. And unfortunately, these numbers are growing, so the latest estimates is even worse. So there is an urgency, and I think we had a golden opportunity, unfortunately you could say, to make crisis into a huge awareness building, while we in COVID really saw all member states realizing that people were dying from COVID because they had cardiovascular, diabetes, chronic respiratory diseases and cancer. And they were at higher risk, they were not diagnosed, they were not treated, they were not protected. So we have felt the momentum, and since the momentum is there, I think suddenly also there is a wake-up call for the lack of healthcare workers. So I have to say it has not been focused as much as it should until now, but coming out of UNGA, as was mentioned already by Katie, we see that this is happening. And I don't know...
is it worse in some regions or countries than others?
So this is always hitting the lowest income countries hardest. And we know also that we have an additional problem because we have a migration of health workforce from the lowest and middle income countries to the highest income countries. So I can mention just to put a sort of underscore on that, even in a government like Norway, which is my home country, we just had a governmental report that showed that we would have almost 50% gap in healthcare workers in Norway. And this is, of course, a consequence of technology development, of universal health coverage, on the flip side of things, so we can come back to that. But I just want to say that I was pleased, very pleased, that during the political declaration of UHE, it was actually as many as 5 paragraphs that strongly call to action. So I think we have the mandate to really work on this, on all diseases, but of course, since NCD is the major part of both deaths, morbidities, and a growing factor, this can be most clearly demonstrated by focusing on NCDs in an integrated approach at the primary healthcare level, of course. So I want to say, so what they emphasized was the critical role of skilled health workforce and fundamental, and that this is fundamental to resilient, strong systems. But it was also a call for accelerated action to invest in education, employment, and retention. So I think it was a clear understanding in the negotiation that we need to address all of these things. And also, I think you mentioned, to secure the distribution, but also to secure the healthcare workers themselves. We see what is happening just now as we speak in Gaza and the West Bank and in Israel. Healthcare workers is more and more unprotected also during humanitarian. We also were able to again convene at the highest level the heads of states and government during UNGA as a side event, and spontaneously it was a very beautiful event with unscripted concerns and commitments from the highest level, and several of them also mentioned the need for skilled healthcare workers. So I think figures is important, and if I'm allowed, I would really want to speak to also, where I see more granular what we need to do, because one thing is to have the highest level of commitment and the understanding, the awareness, but we cannot wait too long to go to the next level. That is, how do we do this?
Well, clearly the priority is to, as you were saying, to try and recruit and train more healthcare workers. That would be the first solution. Dealing with the shortfall at the moment, where do you see innovation and technology coming into that, and what kind of tools do countries have to try and fill those gaps?
So, and I'm not so sure that we can at the global level say that it is the recruitment of more healthcare workers. I think we have to look into distribution and new ways of working, but that comes later. So, innovation, it's such a beautiful word, isn't it? So it gives hope. What I learned in the last 10 years is many of the innovative approaches exist, but they are not recognized. So it's not only about new devices, new technology, but it's really, as Katie said as well, co-creation on how we work together. So I think many of the real solutions will be in the co-creation of new service delivery models rather than gadgets and new equipment, let's say. But if I could mention some things, and I will be a bit lengthy here, I warned the moderator, but I think I just go into this because I think they need to be mentioned. So first of all, it is about data. Without data, we are in the blind.
And that is one of the things that technology can help with.
Absolutely.
Katie was saying, gathering of data.
Absolutely. But also, it's not necessarily known that we have a health labor market analysis that is available. So we have data that is also unused. We also have national health workforce accounts, not in all countries, but in those countries that has established that is already in a better place. So it's of course the innovative way to collect the data, but it's to use the data, and it's also a governmental commitment to make this as regular. Then I think we have support in what has been happening under the leadership of another director in WHO, Jim Campbell, and the strategy on health workforce, and that is the global competency framework. This is a way to be more sort of precise on what do a healthcare worker and also volunteers really need to do. Because sometimes we mix up things. We think it's about the numbers of doctors, the numbers of nurses, and then we forget we have pharmacists, we have a lot of other workers that can help the health system to deliver. So that's also an innovation that needs to be addressed. And also this is very much linked to task shifting. And then it is the big thing that is the buzz, I think, on this meeting and was in New York, and that is how do we really integrate? Because if we think about it, what do we talk about when we talk about integration? I can tell you I'm super happy because for the first time we have 21 approved proposals to the Global Fund to address HIV and cervical cancer together.
Right.
And this is interesting because what it really means is that those who are available, and in this case it's mostly HIV-trained healthcare personnel, they need to also get the training to be able to address the needs for cervical cancer. So it's not only about, getting more people, but it's also the integration needs to really be addressed at that level.
And spotting where there's overlaps that can be leveraged for
overlapped and
patient
retraining.
benefits.
Yeah, and you know, also coming back to technology, that those who vaccinate, for one thing, should of course do the vaccination, including HPV, for example.
Yeah.
So those who offer diagnostics should also take the time to measure the blood pressure or the blood glucose. So it's these kind of things.
So when we talk about innovation, it's not always just about gadgets. It's about different systems, improved systems, different ways of working that can actually cover more patients and more needs.
And I want to make, I know I've spoken a lot, but I'm stopping after two things, which is really very close to my heart. We learned a lot during COVID. And, you know, when we looked at what is the mitigation strategies, so it's very much about health workforce. First of all, it's to find new ways to deliver healthcare services, but it's really a rapid digitalization that happened just out of need. And then it's the triaging, the task shifting. So my question to all of us, where is the strong leadership to not going back to normal, but to create a new normal? And this is not happening out of itself. It is a sort of, you need to have this vision that you want to utilize the innovation that happened during a crisis and is happening during crisis in normal life. I will give one last example because I think it's a good example of how granular we at WHO work on this. And I would again use the cervical cancer elimination as an example, because the world has decided that we want to have 70% women screened with high performance testing and 90% of the women identified to get treatment. So what do we do? And I think it's a fantastic recommendation that was issued earlier this year that can help. And this is sort of introducing the last element for me. And that is a recommendation on self-care intervention. So it's self-testing. And this is very much developed together with the women living with or at risk for cervical cancer. And it's something you can do at home. It requires, of course, a backup of innovative digital solutions. And that is also coming together with the other thing we do is to now try to launch the AI for a diagnostic assessment of the same, in the same area. And something that is very technical, but it's super important that we are able to define target product profiles, because those in the private sector, they really want to be aligned very often on the new technology. But if we are not able to explain very clearly what is the product that we are looking for, then we have a wealth of products that are introduced anyway, but it's not really an innovation.
Yeah,
I will stop there.
Brings it back to what Katie was saying about you can have the best product in the world, but we need to know how to use that in order for it to make a difference. Bente, thank you very much indeed for that. Sahan, if I can come to you, as Bente was pointing out, that the COVID pandemic really shone a spotlight on healthcare worker roles. There are now shortages at all levels, all disciplines. As a physician yourself, what are the challenges you are seeing with shortages?
Well, thank you very much. Good morning, everyone. I think a lot has been said by Bente, and I just want to reemphasize that COVID was a major game changer, like we all know. But let me emphasize the point that a lot happened, even before COVID. We were already seeing health worker shortages before COVID. What COVID simply did was to amplify, and of course, tremendously reduce even the numbers available to do the work. So what we saw were increased losses, on account of COVID. From the statistics by the World Health Organization, we were told that over 115,000 healthcare workers may have been lost on account of COVID. That is tremendous. We're already battling with a shortage of over 18 million. And coupled with that is the fact that we're seeing a lot of other challenges. The issue of mental health burden, a lot of depression, anxiety. Studies have shown that a lot of practitioners were really impacted, in terms of their mental health and all of that. We also had the issue of burnout, because as more workers were being lost, as more people were getting frustrated, as more workers were even leaving the profession on account of dissatisfaction, on account of frustration, you had less and less health and care workers doing the same work that many others were doing. And so the issue of not able to, of course, provide care, timeously, as I went due to patients, especially those who even need this chronic, or who even have chronic disabilities, chronic conditions, was very preeminent. So we had all of that. Eventually, also the issue of violence. We're seeing more and more cases of violence, even in the face of COVID. One would expect that those who are in the front line attending to humanity will be better protected. But what we saw were increased cases of violence. So all of this put together.
Violence against healthcare workers?
Healthcare workers, yeah, physicians and other health professionals. It was very prominent. In fact, in my tenure, I had to contend with issues of violence preeminently in the last 1 year. So that was major, preoccupation. Just last week here, we issued a resolution at the World Medical Association General Assembly on violence against physicians in Nepal. So it's still occurring. So all of that impacted on the already depleted workforce. And of course, you find that that has implications for even service delivery, has implications for access, quality of care, and all of that, even the NCDs we're talking about. Because don't forget, in COVID, we were battling with an emergency. And so those who needed, services on a continuous chronic basis.
Yeah, a lot of NCD services were actually put on the back burner
Absolutely.
during COVID. So what's the situation now regarding NCD management, diagnosis, prevention, treatment?
Well, it's not dramatically changed. We are still in the phase of transiting, really. And people are still trying to see, just like Benty said, I even did a paper on the issue of COVID and whether what we were seeing was real or whether it was just temporary. So the issue of leadership, we are still looking up to whether we're going to have the right leadership to address a lot of the issues that came up under COVID. The issue of political commitment, the issue of governance, the issue of, getting people to really do what they say they want to do. And not just coming around round tables, and then after the round tables, you don't get to see any movement. So I think what we are still seeing is everybody trying to come together in a multi-sectorial, approach, a whole of system approach to see how we can better address the realities shown to us by COVID. And indeed, I must say, even other emergencies we had, health emergencies we had before now. So we're still in the phase of trying to see how we can better now, address issues in a way that we don't come back again to meet a situation that gets us, catches us in a state of unpreparedness. So I think for us, we focus on the issue of getting some level of multi-sectoral approaches to addressing issues that were identified. Preeminently, the issue of the health workforce. How do we create enabling working conditions? How do we create conditions that will make them, stay in their various practice centers? Just now, as I speak to you, like Benty said, we're having a situation whereby the low middle income countries, particularly the countries of Africa, Asia and others, do not even have these workers in spite of having most of this NCD burden. You are aware that the global mortality of NCDs is more in low middle income countries. In Africa, for instance, Africa has about 25% of the global disease burden, but has less than 3% of the global health workforce. And even in the face of that, we have a lot of pulling of the healthcare workers from Africa to Europe, America, and others who do not have enough healthcare workers. So it looks like the production factories in Africa, in Asia, and of course, for exports to Europe. And that has implication for the issue of equity. It has implication for the issue of, the universal health coverage. So I think for us, we're looking at how we can, better, address these realities by also getting governments to be more accountable to their promises, to their leadership issues and all of that.
Yeah, you preempted my question because I was going to say we're talking about how to address the issues. What solutions do you think we should be looking at? Are there any answers, and what should policymakers be doing?
Well, thank you very much. For me, I think the first thing is to accept that we've all not done very well in terms of addressing health issues. Like I told someone, and I said it publicly, the whole world now says that, we now appreciate the place of healthcare workers because of COVID. But the point I make is that before COVID, were they not important? So what COVID only did was to re-emphasize the importance of the healthcare care workers. So first is to get people, to the government especially, to appreciate the place of the health and care workers in every dispensation. Because like Benty said, even if you deploy all the health technologies and you do not have enough health workers emplaced in the system, we're not going to have any kind of progressive solutions or progressive outcomes. So for us, it is how to get that real political leadership. So you can come to sign declarations. You go back home, what happens? Are they binding resolutions? Are they binding declarations? How takes these governments to account? So the core issue of leadership and commitment to healthcare issues,
Right.
I'm not seeing healthcare investments as a cost, but as a valuable intervention. It's very, very important for us. So the question of advocacy, how do we advocate to governments, to the leaders, to see health as a necessary investment that must be made? How do we get them to place enabling working conditions for their practitioners? How do we get them to have very progressive retentive mechanisms to retain them? And a lot of this has to be done even in the low middle income countries. I mean, in the face of COVID, we're still seeing some attraction for medical tourism. Just soon after the gates were thrown open, the international gates, you saw them junketing all over the world and abandoning their healthcare systems. So how do we get them to commit themselves, to providing these enabling conditions for the workers to, undertake their services? How do we empower even the citizens, the patients themselves, to take charge of their own healthcare? So there are a lot of issues that we need to grapple with.
Yeah, and I think everyone in this room and everyone on the panel would agree that it has to be seen as an investment in healthcare, not
Absolutely.
As a cost.
Absolutely.
Thank you very much indeed, Asahan. Paula, let me come to you. A lot of countries suffering healthcare worker shortages. We heard the statistics from Benta and Katie there, and we heard what was happening in Nigeria. So when it comes to addressing workforce issues, what role can industry play?
The good thing about being at this end of the panel is I'm going to be complimenting a lot of what's already been said, so thank you. But I'd like to answer that question by looking back at why I joined Roche in the first place, having been a clinician and then later a chief executive in a public-funded health service, the NHS. It was clear to me, working with the front line, that actually looking at the problems the health system was facing and the crisis in workforce, and the tsunami of demand coming from NCDs, that asking the healthcare workforce to work a bit harder wasn't going to be enough, and that we really needed genuine innovation to support a change. And then furthermore, when I was running the hospital during COVID, and I think it was a real moment for remembering that we often talk about workforce as though they're a commodity, and what I was seeing from people who were working in COVID, who were sometimes described as angels or heroes, was that they weren't. They were mostly female, coming off a shift, absolutely exhausted, not enough workforce, and I think it's really important that we remember that. But what I also saw during COVID was the most phenomenal ability to introduce innovation rapidly, effectively, and safely, with the industry and the health services working closely together, because we had a single focus, which was keeping people, that's the staff and the patients, safe and well. And so I could see that actually I wanted to continue that innovation journey, but to do it from the private sector, where I thought we could continue to make a difference globally.
Yeah, it's really interesting that you've seen it from both sides, and you've seen the huge impact of increasing demands on healthcare workers. So can you share some examples of what kind of things Roche is doing, what gaps they fill, what difference they can make?
Yeah, and it's lovely that Katie set me up for this one with self-testing, because we're all familiar with self-testing from COVID, from doing the lateral flow tests. And of course, what that gives us is, first of all, the ability for the patient to understand and manage their own health conditions. It also saves time from the physician having to take the test, the lab having to analyse the test, and so it really supports the change in the innovation and support for the workforce. Another example, which actually has been done really effectively in Egypt, is end-to-end innovations through machines in labs, making sure that you can get a complete analysis from beginning to end, freeing up lab workforce. And then also another example I'd give is subcutaneous injection for cancer treatments. So at the moment, patients have to go through an infusion, which is many hours through a long line of the drug. And a subcutaneous injection is an injection under the skin. It takes much less time, which means that, first of all, the patients aren't having to stay in a hospital for a long period of time in a chair. It releases capacity, so enables those chairs to be available for people who absolutely do need an infusion, and it means that the product can be given in a more remote area because you don't have to come to a specialist centre for the treatment. So those three are really good examples of how we're moving technology and using innovation to support the workforce.
That's really interesting, and there's a lot of developments in the pipeline. I know that are going to make a difference to workloads. Do you then believe that innovation is something that can help us not just in the short term, but also strengthen the workforce of the future, maybe change the way they work?
Yeah, and I've talked about innovations that are available using the technology that we've got now, but a really important point was made earlier, which is actually that we're looking at the same future, both the industry and health services, which is an increasing burden of long-term conditions, NCDs. And so what we've got to do is work with governments to anticipate and understand what's coming up and then find the right solution to the point that's already been made, rather than finding a solution that we think is right because we haven't done the time in talking to governments and to health systems. And actually, I was thinking of another couple of examples. So at the moment, we're looking at diagnosis. If we added in some AI, and Roche is working on some of this, we can move from diagnosis to prognosis, and then from prognosis to stratification and targeting patients, so that actually we use the resources we've got for the patients where it's going to make the biggest difference.
Yeah, and that is one of the things that AI can do, which is finding out where resources need to be concentrated and where we should be looking at as a priority. Paula, thank you very much indeed. I think what we need to delve into a little bit more now is you've all raised some of the solutions, but also issues of barriers and what might be best practices. So let's go around the panel and talk about that. So Katie, every panelist has said new innovations, new technology, they're all very well, but the integration has to be supported. It has to be properly supported, not least by policymakers. So what are the barriers to that? I mean, what are we talking? You mentioned financing. Is there also political will? Is that an issue?
I mean, I think political will has been brought up before, and, you know, it's very much easier said than done. You know, governments are changing constantly. You know, from an advocacy perspective, we have to deal with this. You know, you build a relationship with the government and then the government changes. So it's constant. And obviously governments have, you know, fairly short-term, you know, kind of mindsets of, you know, 3 to 5 years political term. What can we do in that political term to make a difference, to keep people voting for us? So it's political will is an absolutely essential part of it, as it always is within health. And as was said before, I really do think that this kind of focus on health workforce being an investment rather than cost. Same thing for NCDs, you know, seeing it as an investment, a return on investment. For every dollar you spend on NCDs, you get a return on investment of $7 back. That's impressive. And I don't think we're kind of talking about that enough in terms of really kind of making that cost effectiveness argument. But I think in terms of, you know, new technologies, innovation, what's so important to get things right at the beginning is the kind of the enabling environment for innovation. And what I mean by that is the kind of policy and regulatory environment for digital and innovation. Things like, you know, governments front and centre having a very clear digital health strategy, long term, which really focuses on what are the specific areas, the priorities that are going to be driving the focus, the money, as well as a really clear kind of monitoring and evaluation system so that you can continue to learn and adapt as needed. But, you know, the other piece of, when we're talking about digital technology, I think it was picked up earlier by someone, It's this real kind of intersectoral collaboration that's needed. It's a bit of a classic. We talk about it in NCDs all the time. You know, it's not just the Ministry of Health that needs to be leading. It's the ICT department, it's the finance, it's, you know, education. It's all different parts of the government working together. Easier said than done. I used to work in the UK government, saw it, got the scars. But then also regulation. You know, we need regulation in some key areas like data management regulation to protect the privacy and security of patient health data, device regulation to ensure that what we're really promoting is high quality and is effective, as well as, you know, basics like having an infrastructure in place, having a digital friendly health system that's going to be able to pick up these new innovations and solutions and really scale them, as well as, you know, something I kind of brought up near the beginning is just to focus on people, because digital is not going to be, you know, replacing people. And when I say people, I mean health workers, I mean patients, I mean CEOs of hospitals, I mean everyone. And unless you've actually got uptake of all of those people within on digital, it's not going to really change things. So you really need to kind of have a focus on policies, infrastructure, and people to make it actually happen.
Bente, do you want to build a little bit on that and talk about how we need to train and educate health workers as well, not least in dealing with NCDs effectively?
First of all, I really enjoyed this discussion, so thank you for having me. So I think it's one thing we haven't mentioned that we need to stress, because very often we go directly where the problem is. But actually we have a huge untapped possibility in NCD, and I can see several people in the room working on tobacco, on alcohol, on physical activity, and on health and nutrition. So the first thing we need to do is to try to reduce the burden. And we have an ample opportunity to do that. So that would be one of the best ways to, you know, alleviate the burden on the PHE, I mean, the sort of the facilities and so on. But of course, that also requires healthcare workers and workers in all other kind of sectors. But let's not forget about the prevention side, because that is really the untapped opportunity. We still are not on par when it comes to tobacco use, alcohol, and we are still going in the wrong direction when it comes to the development of obesity and lack of physical activity. So I needed to say that. And here we have very good use of the first two AI healthcare workers in WHO. So I hope my colleague Anselm will mention this, but we have one that is working especially on alcohol, and also Florence, who works on guiding people to reduce or stop smoking. So I think we are already in that space, and we can do much, much more. Be healthy, be mobile is another thing, really pushing big time, huge scale, how to deal with, for example, people with diabetes under Ramadan. What kind of nutritional advice do they need? We can push that to millions of people just through their smartphone.
Yeah.
So that's the thing. But coming back to your real question, so what can we do with training? And I must say that I'm still shocked. I don't know if you will share this view, but a few years ago, together with the International Federation of Medical Students, we just did a quick survey on how much public health interventions for NCD and in general NCD was in the normal curriculum for a medical doctor. And I think, if I'm not wrong, it was around 3 hours in 6 years, something absolutely horrible. So that's why also we convened the strategic roundtable in George Washington University during the regional VHS meeting just now to discuss with deans, you know, what kind of responsibility do they have in this? And I'm not going to give the answer, but I think it's a real need to also, you know, address this from the deans and directors on all kind of healthcare worker institutions, but also for people that are going into educational sector and other sectors.
Okay.
And I want to thank the professional organizations, the World Medical Association for sure, but I'm also extremely happy that, you know, the WONCA, World Council, the World Family Doctors Organization, will have their first launch of an NCD statement this year. It's the first time. And if we manage to mobilize the nurses, and I was hoping that Amalia was here, and Dr. Tedros has appointed the first chief nurse, or actually it's the second time, but it's many years since last time. So again, you know, so we need to have all hands on deck.
Yeah.
But of course, we also need to look at accreditation, curriculums, you know, all these kind of things, graduate training, and I think also the WHO Academy can be a support here. But when I'm talking to people, there is a lot of things going on, but there is no sort of one-stop shop. It's very little cross-fertilization. And I wonder if also, you know, innovation could help here. I have seen people being trained in big hangars for, I'm a gynecologist and obstetrician. So I have seen people being trained for, you know, early, for resuscitation of children born too early, where they train 10,000 people at a time. I mean, where are we when it's come to training of just to measure blood pressure or to manage diabetes? So I think we are really behind in this, and I think innovation and technology should be helping us when it comes to scaling.
Thank you. Paula, talk to me about collaboration, how the private sector can partner with policymakers, other partners to bring innovations to healthcare systems.
When I'm thinking about this, I'm holding a triangle in my mind, actually, and in the centre of the triangle is the most important collaboration of all, which is that between the clinician and the patient, and it's going to help us with this part of the discussion. And then if you go to the apex of the triangle, to a point that was made earlier, that sometimes what the industry can do is assume that it knows the answers that the healthcare system needs. And actually, unless we work really together with the healthcare system, we won't understand what the reality of life is like in which we put the innovation. So that's a really important collaboration. And the second apex for me is about localization, regionals. I don't know about the rest of the world, but even within the UK, not one region is the same, and it's really incumbent on us to be sensitive to what the regions need. And I think the point was brought up before about digital innovation, that there's really not much point in introducing something like a virtual consultation if half the people don't have the internet. So it's important that the industry collaborates regionally and looks at inequalities so that we don't bake in the problem even more by introducing an innovation that doesn't respond to an inequality. And then finally, on my third point, is governments and countries working together to make sure that the environment is set up that enables innovations to be introduced safely and rapidly and quickly, perhaps through a framework. And if those conversations get a little bit fraught, as they might, that in any of those apexes of the triangle, we just reflect again on why we're doing it and go back to the first in the centre, that the most important thing we're trying to get right here is to enable there to be sufficient workforce in the space of NCDs for the innovations to be used in the first place.
Nasahan, what is Africa's approach to digital healthcare? Is it seen as a solution to healthcare shortages, and is there an appetite to work with the private sector to try and bring more innovation into healthcare?
Well, thank you very much. But first, let me just also say something about the issue of training. I think we need to understand that the whole issue of NCDs revolves essentially around prevention, health promotion, early disease detection. And to do that, you have primary care workers who you need to place emphasis on. Now, some years ago, it was agreed that there should be training of what a cadre of doctors known as family physicians. So a game changer for us here in terms of NCD management is to in place a curriculum for developing that cadre of physicians who are primarily on ground to attend to the issues of NCD. on a first contact basis, and, detect diseases early on, prevent, promote, undertake health promotion and all of that. So I think we should not miss that out in terms of re-emphasizing again the need to train that cadre of physicians. And that was why I was very happy when she talked about WONCA. I'm a life member of WONCA, and I think we face a lot of, relegation sometimes in some jurisdictions. People need to know the importance of that cadre of physicians. Now, coming to the issue of Africa, where the issues of Africa are issues that are in evolution, really. We have the issue of already, like I said before, not having enough healthcare workers in Africa. The issue of digital health, yes, is gaining grounds increasingly, but not at the level we expect it to be, because there are a lot of contending issues, issues to contend with in terms of placing digital infrastructure in Africa. So first you have to contend with the issue of lack of awareness, even amongst, the citizens, amongst even the policymakers in terms of the importance of digital health. Then you contend with the existential issues of perhaps, not having internet connectivity in some far-flung areas of various countries.
And where there's no internet, it doesn't.
Yeah, especially in far-flung areas. It may be in the city centers, but where you have need for these are most times in the rural communities, in the remote areas. Yes, mHealth has helped a bit in terms of mobile technologies and all of that. A lot of penetration now is, it's very commendable, the level of penetration we're having in various countries of Africa, but it's still not there because of the existential challenges. You talk about not having the enabling financing, for digital health or digital technologies.
Are policymakers not investing in increasing connectivity? Yeah,
there's not much, I would say it's less than satisfactory. People need to make deliberate efforts to put it as part of the national budgets to finance, investments in digital infrastructure, and of course ensure that you have seamless, transactions, on that level. We've had telemedicine, for instance, in some parts of Africa as far back as over 10, 15 years ago, but they all collapsed because there were no support structures on ground in terms of power, for instance. You need power to drive some of these systems. You're having even an internet connection now, for instance, or communication, and you don't have power to, of course, make for uninterrupted, engagements. You're not going to have that kind of, expected outcome, positive outcome. So one is to have some level of increased awareness as to the importance and import of having digital infrastructure all over Africa. Two is to make it part of the policy framework for governments as, deliberate financing and budgeting for digital infrastructure in their countries. And then three is to, ensure that everybody is involved. This multi-sectoral approach, particularly the end users. The end users most times are left abandoned. So you just sit down somewhere, somebody brings digital technology to you. How do you even conduct, the whole issue of change management processes? People do not accept them. People see them as being forced to use them. They're not used to it. So that needs to be deliberately done in terms of integrating even the end users, in the whole, change management process or health technology interventions, health technology interventions. So I think these are core issues that we can grapple with, but I think importantly is the issue of getting governments to see this as a necessity in terms of addressing the issue of universal health coverage, and ensuring that access is guaranteed, especially to people in rural, remote communities, but also ensuring that there's equity, ensuring that it's not about an elitist approach towards addressing health issues. So I think these are some areas that we need to look at. But like I stated, part of the challenge is that you have governments who don't even think that is needed. Two, you have lack of awareness amongst the end users, non-involvement of the end users, and of course the core critical issue of not having the infrastructure on ground to support even digital technologies or digital health.
Well,
power, for instance.
All the panelists were nodding as you were talking there. So let me get some reaction. Paula, how do we make technology more accessible to everyone?
I think it's a real challenge. As you said, it's certainly an issue for government. But it's also important that the industry plays its part, and if it's delivering an innovation, it considers what it can do to support the infrastructure that's going to be needed from a digital perspective. But I think there's two parts to digital, and one of them, which I think has already been mentioned, which is incredibly important, is the use of the information or insights that come out of the technology as well, that we can use that information and intelligence to inform what we're going to do and who we're going to work with. And I think we've all got a role to play in this.
And Bente, particularly for low middle income countries, they have to make very difficult budget decisions. So how do we prioritise NCDs but also digital health solutions and get that infrastructure in place so that it is accessible?
No, I think I really enjoyed your intervention here, and I would say that first of all we need to use what is at hand. So the Be Healthy, Be Mobile initiative, just using the fact of mobile phones, which we have more of than people in the world, is one example, and it's absolutely great for information, and we are now also starting to use it for data collection. So if you look at, data collection system as DHIS2, it is actually a self-reporting system. So you can combine these two things, and immediately you have, you are closer, I would say, to the solution. I'm extremely happy listening to Paula, because you are, preaching the same as we do, that co-creation is really the innovative action. And I think we have forgot about that too long. We haven't brought in, as you were saying, the person that actually will receive the service in the end. And that's why I also, mentioned this action we do at WHO now, really to try to define what is the product we need. But also, especially in the Global Diabetes Compact, we have systematically involved people living with diabetes to try to see what are the kind of solutions they are looking for that can really change their life and manage their own disease. And I think what we are looking for and hoping for is point of care, both test and treat. I mean, that will immediately change the need for healthcare workers. Last point on financing, I haven't commented on that, but I fully agree with what Kate is saying. And for me, the most important thing, of course, we need more international funding for seed funding. And I think there is opportunities in partnering with private sector foundations, and really sort of spur innovations and make them scalable. And I see in another parallel session here, we are really also looking into different platforms like the one introduced by Macron, where we even are now working with investment banks. So I think there is an untapped opportunity. But again, coming back, there has to be regulatory measures, that has to be clarity on the quality. It shouldn't be diminished. We need to have the surety that this is really a needed product and not one of those that, somebody has a great idea and try to push. So I think this is, so that's for the international funding. And of course, for this to be sustainable, we need to see all the 4 or 5, if you want to include oral health diseases, included in universal health coverage, because that's the way to actually have the financial coverage in the end. But that will be much more easy if we can even increase the return of investment by, have innovative solutions, as we are discussing now, to change the healthcare service delivery. But I want to come back to, that's my point all the time, innovation is not only about new things, it's to recognize old thing that is working, like old molecules, or the manometer, if you want, for measuring blood pressure. And it's very much about how we work combined with new innovative solutions, and we cannot make it without data.
Indeed. Katie, do you want to comment on the need for sustainable financing, innovative financing, particularly in countries where there is less budget to go around and difficult decisions have to be made?
Sure, and I think kind of one of the key aspects of financing is actually something that Bente mentioned earlier, which is about integration. You know, at the end of the day, our global health architecture and the global financing that stems from that global health architecture is still, by and large, pretty siloed and fragmented. You know, we still, even with the Sustainable Development Goals and the philosophy behind that, which was all about integrated, joined-up approaches within health, across development, you know, you name it, we've still essentially got the same global health architecture, which is, you know, it goes back to that point about going up in the helicopter. It's driving these very kind of vertical financing streams at the global level. And that has a really real impact within country, because at the end of the day, if, you know, if a multilateral is funding a specific health issue, countries respond to that by focusing on that specific health issue. I think, as Bente mentioned, things are beginning to change, which is really, really positive. You know, the fact that the Global Fund, PEPFAR, UNAIDS all developed new strategies in the last couple of years and have all, for the first time, really had a really strong focus on integrated health services, people-centered services. And so as a result of that, countries are now responding to the Global Fund, you know, funding windows with a greater focus on NCDs within that. Because I think at the end of the day, you know, health funding at the global level is flatlining. It's not increasing. So I think the question, similar to what we're talking about from a health workforce perspective, is how do you actually stretch that pot further? How do you actually improve efficiencies in spending to make it actually go further rather than one disease or one condition? It's the same for the health workforce. It's not just about increasing the sheer number of health workers. It's about optimization and efficiencies within the health workforce to make sure that doctors are working at the highest point of their license across the whole different cadres of health workers. And then, as Bente says, kind of task shifting specific duties to nurses, to community health workers, whatever. So it's really trying to kind of increase the efficiency of spending globally, the efficiency of funding. And by doing that, essentially what we need to be doing is integrating NCDs into these different kind of funding streams, whether it's HIV/AIDS, whether it's COVID-19 and pandemics.
So I think we have our chief nurse from WHO.
Oh, lovely. Well, I will definitely get a comment. And just one last thing, Katie, before we go to the audience, is Sahan's point about lack of awareness of what is available and what is achievable. How do we change that?
I think it goes back to training, essentially. I mean, if you're talking about awareness within the health workforce of, you know, different digital solutions, it goes back to training and making sure that we're providing continuous training for health professionals across their whole career, from primary healthcare to tertiary level, making sure that, you know, we really, as I said at the beginning, focus on what's working and cross-fertilize that across regions and at the global level to make sure that actually where the money's going is actually focusing on cost-effective solutions that are working for patients at the end of the day.
Brilliant. Thank you. Thank you to all my panelists for the moment. They are going to take questions from the floor, but Bente has kindly informed me that the appointment she was mentioning, the chief nurse to the WHO, is in the room. And I'm so sorry to pick on you, Amelia Tuipulotu. But I wondered whether you had any comments. I know you're also taking part in a session a little later on today about the future of nursing. Whether you had any comments about how innovation and technology can help with nursing shortages. If you could stand up, and I think a microphone will come to you. Yes, there you go. Thank you so much, and apologies for putting you on the spot, but we'd love to hear what you think.
Thank you.
You can just stand there and...
Thank you very much for engaging me to this very important session. And of course, nurses and midwives are the majority of the health workforce. And of course, very supportive of how innovation can empower nurses and midwives to deliver at national, subnational, and rural contexts to serve the vulnerable population of the world, and of course, promote and keep the world safe. I just want to share from the context of Tonga what we did. I was government chief nurse of Tonga before I came to WHO. What we did was an education training for specialization on NCDs for our nurses to be able to ensure that care is accessible at subnational, remote islands, and rural contexts. Upon review of this implementation, there is satisfaction from the population because they can access and ensure out-of-pocket financial burden on our population. So they were able to access care, quality, safe care, right next to them at their rural remote context. Of course, there are issues with regards to moving forward with equity and ensuring there is the supportive, enabling health system to continue for the long lens. But this is something that can be done, and I hope that innovation can empower nurses and midwives to deliver for the population of the world with regards to NCDs, of course, in a multidisciplinary team all the time for the population. I thank you very much.
Amelia, thank you. Thank you very much indeed. Now, we've got several hands up for questions. Let's start with this gentleman at the end of the third row here. If you stand up, sir, at the end of the, and a microphone will come to you. Thank you. If you can tell us where you're from and who you're directing your question to, that would be great.
Thank you very much. My name is Modrek Chibi from WHO European region. Basically, this is a sort of a general question to every panelist. I mean, this has been an incredible panel that I've listened to for the past, I don't know how many years, and congratulations to all the panelists. I really like the comment around governments setting up strategies really to set the direction for innovation. But one thing that I also didn't quite get from the panelists is the issue of innovation ecosystem. So I didn't get that word. And why I'm mentioning innovation ecosystem is to introduce efficiency. I can give you an example. I work in innovation, so basically we supported the government of Botswana to set up what is called an innovation ecosystem management. So basically what the government of Botswana is able to do is to be in a position to articulate the demand for innovation and harness those innovations that respond to those innovations and elicit or even trigger a network of strategic partnership that support scaling of innovations that respond to their priorities. And also the issue of now monitoring and evaluating the impact of those innovations for integration.
That's a great question.
That's one thing that I really...
Well, let's start with that, because I think that will do for starters. So
Yes.
how we encourage governments to, as the gentleman's saying, set up strategies to fully integrate digital solutions into their thinking and monitoring. Does anyone want to take on that? I mean, clearly...
Well, let me just...
Yeah, you go ahead.
Yeah, thank you very much. I think it's a very germane question. Different countries have their different approaches to this. In my country, for instance, there's a Ministry for Science, Technology and Innovation. And so what is important is how you drive even those, platforms. And I'd like to appreciate you for the kind of, interventions you made in that country. I think what is important is for us to not only in place these kind of platforms, but of course to ensure that the necessary support structures are put on ground to drive them. One is the issue of empowering those who are going to be involved in driving such systems or ecosystems. How empowered are they? I mean, because you cannot have innovation without research, for instance. You cannot have innovation without research. Research is fundamental towards driving innovation. And what we see across countries, especially in Africa, is lack of financing of research. And so individuals are left stranded on their own. Even government agencies at times are left stranded. So how do we support research to support innovation and all of that? So while yet it's important to put on ground such platforms, the necessary support ingredients, in infrastructure must be put in place, empowering those who are driving the system, empowering, supporting research, and of course, supporting utilization of the outcomes of research. Very important.
Thank you, Hassan. Another question, middle of the third row, the lady there. Thank you very much.
Hello, thank you. I'm here representing the Conference of International NGOs at the Council of Europe, but I'm a nephrologist by profession. I was very impressed by the talks that people were giving, but there was very little mention of patients, although was talked about in terms of patient-led innovations or working with patients to develop innovations. But there is a conflict between between having task shifting and having specialized clinics for people with non-communicable diseases, and also the idea of integration, because many patients, especially the elderly, have multiple pathologies and therefore could quite end up in a situation where they're actually having to relate to 3 or 4 different health professionals and different health clinics, because each one is focusing on a particular disease. And we're losing that integration that primary care used to give in terms of somebody who had the ability to deal with all of those things. And I think our voices want to say that the patient should be at the centre of how you design innovation in terms of health force.
Thank you for that. Katie or Bente?
So I think, first of all, thank you. And I think we didn't say maybe patient, we said people with living with, and we say also person-centered. So, but I think your point is very much taken. And you were asking earlier, Julie, what to do at low and income countries, low and middle income countries. And of course that is exactly very much the problem, because many of these countries has something similar to a primary health care service, but it's linked to HIV, TB and malaria, because that is where the funding came from. And now we need really to see the whole person. And as you also said, there is a need for multidisciplinary teams or dimensions. So I think your point is absolutely valid, and I'm sure all of us are very much aware and in agreement of this. That said, also, I think we need to think through that. For example, I had a very interesting meeting with the International Pharmaceutical Federation, and they described that they are knocking on the door. They have a lot of resources, they are not let in. So we are not necessarily even looking at all the different workers that we need to do, including what you were saying, the whole ecosystem that is needed for digital.
Yeah, I think you're bringing up, for me, 3 really important points. Number one is, multi-morbidity is essentially the norm rather than the exception these days. So we need to make sure that our health systems and our health workforce are responding to that. Number 2, it's about, promoting patient-centered solutions, and actually, what we talk about in the NCD Alliance is meaningful involvement of people living with NCDs, which is a massive mouthful and very difficult to say. But essentially what we're saying is that patients need to be involved across the whole response, whether it's innovation, whether it's developing policies and plans, whether it's designing health services and solutions, and then it's about monitoring and evaluation of them. Patients need to be at the centre. I think in NCDs we've been a little bit slow at actually realising that and fully embracing it within how we're working. And then the third one is, and just to kind of repeat this, because it's so important from an NCD perspective, it's essentially investing in primary health care. This is a core part of the universal health coverage agenda. I'll be in Astana next week for an international conference on primary health care, which is really, recognising the anniversary of Alma Ata of 5 years since the Astana Declaration. But, why it's important for NCDs is because essentially, you can do so much at the primary healthcare level for NCDs, and making the most of that one, visit to a health service for a person, maximising it, going back to Bente's point about the one-stop shop, making it easy for people. Because at the end of the day, as you say, if people are living with dementia, diabetes, hypertension, having to see different doctors or specialists for those different conditions, on different treatment regimes, on different it's a nightmare, it's a full-time job. And so making it as easy as possible through having a real focus on patient-centered responses.
Thank you for the question. Let's have someone at the back here. The gentleman at the end of the row there. Thank you.
Thank you so much. So nice to see Katie and Bente on this discussion. My name is Mohammed Abdulaziz. I head the Division of Disease Control and Prevention at the Africa CDC, where NCD lies. Really a great discussion on the different things we need to do to scale up treatment and coverage of non-communicable diseases in the community. To Bente's point, we need to see how we can link the different fundings available for UHC and other distant to that of non-communicable diseases. And Katie just talked about using the PHC as the tool to drive this. My question to either Katie or Bente is, how do we increase the role of government, the role of Ministry of Health in achieving this? Not just, because for NCDs we see a lot of work being done at different, how do we get the Ministry of Health, the government to be more involved in coordinating this so as to scale it up at scale before we can really achieve any success when it comes to covering non-communicable diseases in the community? Thank you.
Thank you. So increasing the role of government when it comes to both communicable and non-communicable diseases in the community. We've talked about the onus on policymakers to provide an environment where health workers get more support. Maybe Asahon, do you want to talk about how we...
Well, I think first did not tell us that it's from Nigeria. I think you are from Nigeria. So maybe you are talking about our Ministry of Health. But I think the first point is to first have a policy on NCD, because the ministry cannot drive something in vacuum. I mean, there has to be something in place. So is there an NCD policy to even talk about?
Sure.
Most countries have NCD policies, you know. So if you have an NCD policy, and I think Nigeria has a very profound policy document on non-communicable diseases. So if we have that, if the country has that, or any country has that, the next point is to see how to, of course, drive the process. And that is where the whole issue of getting, governments to commit themselves to such policy frameworks comes in. And if you also have that kind of policy in all sectors, then it makes it easy, because NCD is about everybody, really. It's not about one individual or one sector. It's about everybody. We're talking about health prevention, health promotion. Health checks, for instance, is something that is universal. So get governments to commit themselves to that. And also in that is the place of empowering the citizens to get governments to commit themselves to it. So if you have policy frameworks and nobody's talking about it, the citizens are not as silent about it, are not getting their governments to run with those policies, then it will never come to light. So how do we empower the citizens to demand for some of these expressions, whether in the policy documents or in the legal frameworks? So when you look at all of this, and you see governments will necessarily understand the import of driving this. And of course, if you do the case analysis for them in terms of the advocacy case analysis to see the implications or the outcomes of driving such laudable policy frameworks, I'm sure they'll be readily committed towards driving these issues.
Thank you. Thank you. Another question from the floor. Gosh, there's so many. Let's take this lady at the end here of the third row. Thank you.
Hi, thank you so much for these presentations. I'm a primary care clinician, and I'm also the Planetary Health Policy Director at the Harvard School of Public Health. And I came to this session because I have been in a lot of sessions on One Health, and I'm curious if you have comments on how we're going to bring NCDs into One Health and the One Health approach. And thus far, we have had a tremendous focus on communicable disease, environmental factors related to communicable disease, but not a lot of discussion on non-communicable disease and environmental factors that affect non-communicable disease.
It might be a little off topic as far as innovation is concerned, but I'll give the panel an opportunity to answer. And I'm guessing that innovation and data will also help us understand the impact of environmental factors on non-communicable diseases. Does anyone have a comment about that?
I've got a
Sure.
thought,
Go
if that
for it.
helps. I may not answer your question, so apologies. But I was wanting to connect a couple of things, which is A, how to get governments to respond, but B, the ecosystem as well, and making sure that the health ecosystem supports the generation of information, ideas and evidence around the benefits that you're going to get from using innovation. Because I think the strongest argument that a government can hear is that comes from the ground, that's very clear about how it's improved outcomes and the difference it's made in terms of efficiencies and productivity, because that's a message that everybody needs to address. So I think there is something for us to look beyond the standard collection of clinical effectiveness evidence to looking for evidence on the impact that dealing with early intervention, diagnosis, prevention is having ultimately on the health outcomes for people. And there's a role for the industry particularly in supporting the collation and collection of that real world data once we've been through the clinical trial perspective. So I don't know if that answers your question, but I think it's about generating the opportunity to have the information and the evidence that supports the argument.
So I want to make two comments. So one of them is to point to an opportunity. So if we want to strengthen ministers of health, we need to have very strong resolutions at the highest political level, the heads of states and government, and that happens during UN General Assembly. And we are just now preparing for the 4th high-level meeting on NCD. So everything that is missing, that is the biggest gaps, also addressing, I think, innovation and research is definitely an area that needs to be strengthened. That's also why we have a technical advisory group on innovation and research for NCD, chaired by Professor Adnan Haider. But anything that you can see, this is the time to prepare. Just a quick one on One Health, and I will make that more general because there is a need for NCD to read itself into environmental crisis, into inequity, into gender parity, and also to One Health. We haven't been clever, I would say, enough. And we absolutely need to be there. So the very sort of quick answer is that we work together at WHO on One Health. And of course, immediate is, of course, the post-COVID and food security, which is a sort of very clear link. But I can tell you that this is very well recognized, that we need to sort of be in this space to be relevant, but also to address the reality. Thank you.
Now we're coming to the end of the session. I'm so sorry we don't have time for any more questions. I do see that we have Anselm Hennis in the room with us, who is the Director of NCDs and Mental Health at PAHO. Anselm, I wonder if I could just ask for just a few seconds of reflection about the need for innovation when it comes to dealing with healthcare workforce shortages in the field of NCDs.
Yeah, thanks for a really stimulating discussion from the panel. Thanks to colleagues. And I think really we learned a lot of things during the pandemic. In the region of Americas, 3 million people lost their lives during the pandemic, and everything had to change. So we used innovations in terms of telehealth, telemedicine, we did teleconsults. A lot of the lessons we learned there are quietly being lost because we have not recognized that we have learned lessons. There are disparities, as you know, in terms of access to information across the rural-urban divide because of disparities, etc. But there are many good lessons, and I think Katie outlined very quickly the infrastructure needed to sustain telehealth and telemedicine. These are things we need to adopt rather than lose. Issues of prevention and promotion. Issues, for example, and Bente spoke about it, we have health workers in WHO and at PAHO, which helps people in terms of prevention, in terms of health promotion for alcohol and tobacco, etc. These are spaces that we're trying to retake because they were very helpful during the pandemic. Issues of training. And in fact, PAHO has the virtual campus on public health, which has been a tremendous tool. We have the Hearts in America's program for improving hypertension control. And we have been able to train over 200,000 health workers in terms of hypertension control. These are tremendous opportunities. Once you have the courses that are running, people can do them in their own way and become accredited. And this is one way to improve the skills and the capacity building for primary care workers. We talked a lot about primary care, and this is really where the rubber hits the road. And we have to strengthen our approaches in primary healthcare space. There are also things like apps, which are important. And the other thing I'll talk about also is the fact that information for facility-based monitoring is another lesson that we have learned. In the Hearts Initiative, what we find tends to limit our ability to roll out and to assess what's been done is that the primary care facilities don't have good systems in terms of digital architecture and data monitoring systems. Unless we invest and make the case, the political case and the technical case, and show the return on investment, we will not be able to advance primary health care in a meaningful way because there's no data to show that it works. So there's so many things that need to be done.
Thank you very much indeed. I'm going to, in the last minute that we've got, give our panelists 30 seconds each, and I'm going to hold you to time, speakers, because we are running out of time, just to give your final thought about what it is we need to see to alleviate workforce shortages with innovation. And let me start with you, Katie.
I'll keep it less than 30 seconds. I would say number one is the UN high-level meeting on NCDs in 2025 that Bente just mentioned. Fourth high-level meeting on NCDs, a really big opportunity to be making sure that governments are making new commitments, keeping to the commitments that they've already made, making new targets to accelerate response. Health workforce has to be a really important part of that high-level meeting.
Thank you. Bente, 30 seconds or less.
So there cannot be any UHC without the sufficient, well-trained numbers and also capabilities of healthcare workers and other workers supporting healthcare. And the second one is that innovation needs leadership. It needs to be based on co-creation, and the funding can be widened up to those who really look into investment and scale.
Thank you. Sahan.
Well, implement universal health coverage with, of course, the backbone of robust, comprehensive primary health care, build resilient health workforce with resilient health system, and of course, integrate digital health and digital solutions in all policies.
Thank you. Paula.
We're stronger together. Collaboration and co-creation is really important, and that's on the ground from making sure that you can get the value out of the innovation by working to change the health ecosystem, the health system, as well as supporting the workforce as well. So let's do it together.
Thank you. Thank you very much indeed for all your valuable insights. Thank you for your questions as well. Really engaging. I hope you've enjoyed this session as much as I have. Please give a final round of applause to our speakers. And I understand that lunch is now being served, so please enjoy your lunch and your break. Thank you.